Uh, it's almost 8 o'clock. I request Dr. Medha Joshi to read the biodata of Dr. Nirmala Rege.
Thank you, Sanjay. And it's really my privilege to introduce such a multifaceted academician to you all. I know most of you know her as in various capacities that she has worked in, but I got to know her maybe few years back. Formally, I knew her earlier just hello, but later on, once we started working for MERP, that is Medical Education Research and Publication uh, course through MEU, I really got to know her and realized how meticulous she is in everything that she does and goes into depth of each of the things. So that is something which is really appreciable I really appreciate in Dr. Nirmala Rege. We all know her friends know her as Nima only. So I will take the liberty of introducing her as Nima. She is a alumnus of St. GS Medical College, entered there as a UG student, completed her PG there, joined as a faculty, and finally superannuated as a professor, head of the department. And then she still continues the association with KEM as a professor emeritus. She is also currently working as a professor of pharmacology at ERA's Medical College, Lucknow. And she is a faculty of ERA SUV certificate course as well as the postgraduate diploma in health professions education. Now, if you look at the various positions that she has held, academic positions, she was a coordinator of medical education unit of KEM. She was also a co-director of Famer Regional Institute at KEM Bombay. She's an academic head of National Association of Pharmacology and Therapeutics and has designed a national level certificate course for pharmaceutical physicians to increase the awareness of the PGs, pharmacology PGs regarding the pharmaceutical industry. She was involved in both UG and PG curriculum development. She was also involved in as an advisor and past president of AHP and of South Asian College, which is an affiliate of the American College of Clinical Pharmacologists. She is the vice president of Allied Health and healthcare professionals of research, education and research. She nurtured the Ayurveda Research Center at St. GS Medical College and has been involved in number of projects where she has worked on Ayurvedic drugs, medicinal plants, and other various researches. She has more than 120 publications to her, 125 publications to her credit in national and international journals, 22 book chapters, 2 textbooks. I have highlighted Satoskar and Bhandakar pharmacology because that is now, when we were studying, it was considered for UGs, but now it is a book which is referred mainly by postgraduates in pharmacology. So she's the co-editor of that. and practical pharmacology for medical students. She is also a co-editor of 15 books and manuals on research methodologies. She conducted a number of workshops on medical education, research methodologies, and Ayurveda, including teaching and medical students and SLOs in pharmacology. And she is on the editorial board member of medical education, research, theory, practice, publication, and scholarship. And other than that, I think she has so many other interests in, as I said, Ayurveda and medical education. She is really a multifaceted pharmacologist, and here I present to her as a friend, as a co-pharmacologist. Nima, the floor is yours.
Yes. Will you please stop sharing? Yeah.
Yes.
My slides are visible?
Not yet.
Yes, no?
No, not yet.
I've shared. Not yet?
No, not yet. Maybe you can reshare them.
Yeah, I'm doing that. Now?
Yeah, it's coming.
Now, full screen?
Yeah, full screen.
Okay. Thank you, Mehta. Thank you for the kind introduction. And my sharing is paused. And I'm grateful to Dr. Tejinder Singh and Dr. Sanjay Bedi for considering me worthy to deliver this prestigious Dr. Rita Sood Memorial Oration. Dr. Rita had towering accomplishments, which always reminded me of Mumbai's Rajabai Clock Tower in that Mumbai University campus. Though she was a very small statured, delicate woman, I always remained admirer of her, and perhaps because of respect towards her, there was some distance from my side of it. I came closer to her when I first met her at CMCL, Famous Regional Institution, and later on at National Conference on Medical Education. That was the first which she organized, and then it became from 2009 National Conference of Health Professionals Education. And they traveled together to Famous for training of director and faculty of regional institution. Then later on, she was a president of AHP, and we organized that time the NCHP. I was a joint organizer. I was the organizing secretary, and then I met her a little more often, and we used to talk about how to go about this conference and its various scheduling and all. What I realized during this interaction, she had a clarity of thought. It was totally against me. I'm always confused at last minute. And she was visionary, very much focused, and her passion was health professions, particularly the medical education system in India. And that has reflected in her papers, published papers around that time, from 2000 onwards. And they are of such a good quality, and you can't study medical education system in India without looking at her papers, going through it. And many of her suggestions have got incorporated in today's CBME. And a lot of thinking went back behind this writing these articles or organization. But ultimately, always she used to come out with very simple, feasible, solutions, which are activities, and they used to be useful for masses, community. So many got benefited because of her vision in the, and activities in the health professions education. I can't forget her teaching when she had told me once in informal meeting, and at that time I was very much. Everyone was telling me for the NCHP or 2013, you do this, do that, have this session, that session. But she told me that to remain focused and see what are the needs of our Indian faculty, and then have design the sessions for them. And this teaching has gone a long way with me. Today I'm going to talk on Educational Research Journal Club, and many of you might be wondering that you know Journal Club. So what's so great in that talking about it? But let's see. This is, everyone will agree, this is a timeless practice, and we will see whether we can rediscover some values within it. Actually, when I was thinking about it, what stimulated me to take this topic was earlier Rita's oration given by Dr. Chetna Desai, my friend. And her topic was health professions educational research in India. And I stopped at one line which she had mentioned in Way Forward, and that is there is an increased critical mass of health profession educators who are also researchers. And that I kept on thinking how it is possible, because the research which is coming, getting published, is mainly from the people who have done some master's course, or they are ACME members, or they are FEMO faculty members, and from other people who are not from India, but from others. So how in India we can do that with so many teachers around? And everyone is not interested. And then in the month of June, I was called to inaugurate a medical education research journal club. And that idea was Dr. Minal Mongaonkar. She is a dean of SMBT Institute of Medical Sciences and Research Center, which is situated at in Nandi Hills and in a district of Nashik. And when I went and I talked to her, and she gave her side by, or her perspective why she wants to have it. I also started thinking in that term. This is, as I said, it is an old age tool, and whether it can be useful. And now, madam told me not just we inaugurated it in the month of June, but they have started the journal club. And they have a journal club of, first journal club also was over. It is every month or bi-monthly journal. So let's see. I started looking at the literature. So let's see what the literature says and my thoughts over it. Now, all of you, as I said, we are used to journal clubs as a health professions educator, as a person from with medical background. During our postgraduate years and later on, they are the part of our academic routine. So this is a dedicated meeting where academicians, researchers, practitioners gather to discuss the publications from peer-reviewed journals that are relevant to professional issues. But do you know who started the first journal club? He was Sir James Paget. He was a British surgeon and surgical pathologist, and you must have heard about the Paget's disease. So the same fellow, whose name has been given to that condition, he started reading journals regularly with his students around mid-1800. And where was the place? It was in Baker's shop near the hospital gate in London. And since that time, it has become a habit, or it has become common to have snack available at journal club meeting. And I've read somewhere that one of the reasons for ineffective meeting is the participants who are more interested in the snacks rather than in the journals. Later, in 1877, Sir William Osler started the first formal journal club for the undergraduates at McGill University. And he started with the idea that some of the periodicals were very costlier. So distribution of these unaffordable periodicals to students. And then ultimately it evolved it into the journal club where they met over the dinner to review whatever is coming as a latest news or recent advances in medical research. So, but these are all related to the medical education. The two things William Osler mentioned. One, they wanted journal club to offer opportunities of learning how to prepare papers and express the ideas correctly. And second, to give training in the difficult science of debate. That was the thing when the journal club started. But it has continued in our science as continuing medical education. And its nature change rather than having to know about the recent advances. The focus came on to develop the critical appraisal skills and to learn, of course, the advances in the field, but link that advance with the practice. And all of you know that we have changed from that whim-based medicine, I do as I wish, to eminence-based medicine, that I do as my teacher does, to now a conscientious, explicit, and judicious use of current-based evidence for making any decisions. So we practice the evidence-based medicine. So, but in that tune, the journal clubs are also here to discuss the practical implications of the research findings with others. Because most of the time, 90% of the research which is published in the journals doesn't come into practice. And this, it was thought, was a good idea. If you look at the health professions education and how many journal clubs are there, I couldn't get the information, not even of the first educational, forget about the educational research journal club, but the education education journal club. Because there is a dearth of literature related to that. So, but there are few articles or short reports that it was held at university level in Canada, in Stanford University, maybe it is practiced even in India, at institutional level, and maybe now at the medical education units at the departmental level. And one of the example is where I work now, that is IRAS Lucknow Medical College. We have medical education journal club meetings, but all these are restricted mainly to the faculty from the medical education unit. And majority of the faculty members of the college, they are not the part of it. So the focus has remained only on the small group, the group which is likely to do some research. Now, if we think about the quality of the healthcare, all of you will know that it depends on the quality of the health professions education. And whenever we address quality, we need some evidence base. So for education also, the evidence provides the basis for making any educational policy or the practice, rather than the expert opinion and convenience as we have seen for the medicine. So what we need is an evidence-based education. And thus, I feel the journal club as a tool to empower the faculty. Now, there are two opinions. Sometimes people say that journal clubs are sometimes successful, sometimes they are ineffective, and there is a lot of literature related to that. But which journal clubs we can say are successful? When the participants get engaged themselves in some lively discussion, where they are critically and honestly exploring or evaluating that study, whatever the study they are going through, its strengths and weaknesses, they are taking away the insights of what to do and what not to do in their own work. And when they feel inspired by new findings and they want to put them into practice, or they walk away with ideas of their own research. But there is no gold standard to say how a journal club should be conducted. And there are again plenty of articles. There are different formats of journal club have now evolved. We always know about the classic one where the trainee is subjected to present a journal club as our postgraduate students they present. The senior clinician or maybe sometimes senior postgraduate will select the article for discussion. Then there will be advanced circulation of that article. The trainee will present the slideshow summarizing and critiquing the article. And the senior person who is there who will facilitate the discussion. Whereas the flipped classroom, uh, in case of another format is to use the flipped classroom, where there is a journal club team with, of course, a senior clinician or a expert who will facilitate the process. So the trainee volunteer will present, co-select the article, he will present the critique, and he will circulate that in advance to all the people with the presentation, pointers, guide, etc. And when the journal club begins, it is focused on the small group discussion on that particular critique rather than going through the entire article. So that trainee will lead the group discussion. Whereas the recently, which is called as Journal Club 3.0, which is a digital, or 3.0, which is a digital platform using Twitter as well as other social media use. And here, the JC team again facilitates the JC process. But here that the core JC member decide the time and duration of the that when the JC will occur. There is an advanced posting of the article, which is online along with the guide pointers. And there is a real-time online JC at designated time, open to online community. Now this has helped, and then the summary and whatever the discussion are posted and they get archived also. Now this has an advantage that you are now transgressing your boundary of the department or institution across the nation, across even internationally. But again, there are pros and cons for this particular type of digital platform, though people think that it could be very powerful also. The people also use open educational resources, and what I mean by the open educational resources are the blog posts, podcasts, etc. Along with it. And therefore, if you this is a current article in 2022, which says that we can phenotype the learners. The learners can be of three types. One is traditionalists, no spoilers, and melting pot. Now, what the traditionalists do, these learners intentionally avoid engaging with this open educational resource. They remain concerned with whatever the article is given. They feel it is too much overwhelming going through those resources and then finding out, and too much time is wasted. Whereas no spoilers one, they will attempt to perform the unbiased critique of the article given to them, but later on, they will reserve that use of open educational resources as a comparator once they finish with their job. Whereas the third category, they seek various perspectives available and they integrate into their personal analysis of that journal article. So these are just the phenotypes which are there. But we have to see if we want to go for this online journal club, in which category we are going ahead and whether that is suitable for. And that is again very important to decide the success of our journal. There is as I said earlier, there are many articles which have been published for the journal club, how to run it and how it will be successful. But in 2010, there was a 12 tips published in Medical Teacher for conducting medical education journal club. And I thought that I will just go through these steps quickly. First thing is to consider how it might be of value to the faculty, because you should know your faculty well, what they can digest, what they can't, and what their focus will be, what are their needs. The second thing is always decide what is the goal. Whether you want to keep the faculty abreast the health science education literature, or you want to foster the education research, as I'm going to talk about, or to learn the new and interesting teaching tools and websites, or you want to stimulate the debate because that can help in the more and more discussion, as we say, vade vade jayate tattva bodha. That means you learn more and you understand it better, the principles, when you start arguing, or teach the critical appraisal skills, or teach the new educators, your trainees, about the important research skills. The third tip is make a decision about the frequency of JC and plan the regular meeting. And this is very essential to schedule the meeting so that people will keep the time aside, and that time should be appropriate for the majority of the faculty members. Tip 4 is recruit broadly balanced representation of participants. So there should be medical education researcher, both basic science, clinical teacher. There may be other health professions education courses running, so their faculty, students. You should vary the leadership of the JC, and I will come to tell you later on what is meant by this. Articulate the criteria for selection of the article, which article you are going to select, and develop the guidelines for the conduct of discussion. It is better if you can have a template for presentation, at least the points, and then consider the ideal number of participants. Now, what the article mentioned, this particular, that it should be ideally should not be less than 5 and more than 15, but they have also said that depending on your condition, depending on where you are working and what is your goal, you can have more. And decide in advance whether you will circulate one article or more article for discussion at each individual basis. Again, that depends on the agenda, because if it is an educational research article and you want to learn your students or the faculty members critical appraisal, then naturally one article suffices. And disseminate the results of the journal club meetings. How to disseminate it? We will see later. The tip 11 is to remember the wrap-up component of your JC. That means you should summarize at the end. Don't leave. There will be many discussion points will come. Don't lose them loose. And come out with the strengths and weaknesses, how the study might have been conducted differently, or how the manuscript might have been improved. There should be discussion. And there should be brief outline of plans for the next meeting. And all these things should not go just verbal, but you put it on the paper and then you disseminate the results of the journal club meeting, maybe at your through email to the participants. Maybe you can put it on the website of your own institution. And tip 12 is to evaluate the journal club program in an ongoing manner. It is a program, and therefore the feedback matters, and collect it, and therefore feedback forms have to be there, and conduct the annual summative program for evaluation and for the plan of modification, whatever you have made. But for a successful JC, the 3 stakeholders are important: the organizer, leader, and the participant. And who is the leader? Leader can be a person who is expert. Now, if we are talking about the educational research journal club, then the person may be an expert in the educational research. He may not have the expertise in all the fields, but at least in some of the fields. And he should be trained to conduct, he should be a good facilitator so that he can conduct that journal club properly. He should select proper articles. He should facilitate the meeting. He should present, and he should present in an engaging manner. So he should decide what part should be present and how it will be interesting to the others. And he should create a safe environment so the participants get encouraged to participate in. And therefore, you can't keep one person as a leader throughout, but you can rotate the leadership and give others also a chance. And sometimes you can give a chance to a novice one and see which facilitating skills the person has, and you can guide them. And on the other hand, the organizer should prepare schedule, the announcement, presentation templates, attendance sheet. And this is also necessary thing for a successful journal club. If you don't keep the attendance, after some time, the people start, the attendance start dwindling. That is a observation of many. And the feedback forms. Which journals one should say? So the journals that publish good quality of educational research. And most of the people who are here, they are from medical education unit or from FAMER. And everyone knows the definition of educational research, which is a rigorous, systematic, formal process of carrying out investigation of any aspect of education followed by scientific analysis of gathered data. So in the journal club, we have to see that all these processes, the investigation which are carried out, and the scientific analysis of whatever the data is gathered, everything is done in a proper manner. So and when I'm saying any aspect, there are multiple aspects. I have not captured even in this particular slide. It could be teaching learning methods, it could be assessment, it could be on motivation, teachers training, student learning, educational environment, maybe new program strategies, classroom dynamics, anything. We will see some of the areas of research later on. Now, which journal should be selected? Now, some of our medical journals have a medical education section or a education forum. This is a big list, but these are the journals with, they publish good quality articles. So one can go for this medical education, education for health, even Southeast Asian Journal of Medical Education, BMC Medical Education. And there are certain Indian journals also, Indian Journal of Medical Research, Journal of Postgraduate Medicine, International Journal of Applied and Basic Medical Research, Perspectives in Clinical Research. All of them, they publish these articles related to the medical education research. Now, there are, as all of you know, there are two sources. One is the primary literature, that is these original research papers. They may be in the form of case studies, they may be in the form of editorials or the letters to the editors. And in the medical education, this really good stuff, the abstracts are presented around 500 words. And in the Journal of Southeast Asia, the medical education, outside the box, it allows the publication of abstract, which is 750 up to 750 words. These are the some innovations which have been done. So all this primary literature, if we review in the journal club, that provides new information. But there are secondary literature, and this secondary literature will be the review articles. I already told you about the 12 tips for the medical education journal club, but there are many such articles, and AMI guides are there. In addition, this BME, Base Evidence Medical Education Pro, gives a meta-analysis. There are guidelines, there are book reviews, commentaries, and you can occasionally even select the articles from this. If a primary literature article, if it raises some query, it is a good thing that in the follow-up journal club, you can go for this because it summarizes the information concisely, and it is presented in a way that is very easy to assimilate. So you can select any of them. And again, it depends upon the research area of interest of the participant. And you can see over here, there will be some overlapping what I have shown you earlier, but it is related to the teaching learning process. It is related to the innovative program like family adoption, or maybe communication, humanities in medicine, related to assessment, or computer and AI assisted learning, gamification, faculty development. Now, don't get overwhelmed. There is a plenty of information, but we should not get drowned in the information, but we should starve for the knowledge. So selection of these articles should be there when you remain or you stay focused. And how you do that? You can decide depending upon the topical nature of the content, what has come as new, what has been updated recently, what is the appealing thing, and what is the novelty in the research. And that becomes the role of that leader. And how we can link that article with your group's interest. And that's why I said you should know the needs of your faculty and what are the expertise of the faculty. And sometimes you can select the article that can create some controversial matter or that have some uncertainties. And of course, you can look at the credibility and reputation of the authors for selecting the article. There is one journal club experience, a short report was measured where the journal club itself was devoted to the educational issues. So these particular people, it was by medicine and nursing faculty, they selected the articles which related to the educational issues only. And then, unfortunately, that report is so short, it was published in academic medicine, that I couldn't make out what is meant by this uncertain and problematic education situation. They have not given examples. But they have mentioned, then on that issue, there used to be discussion and analysis, and different perspectives were presented. There was exchange of experiences, and people offered their own solution. And then the summary was circulated, and that summary was found to influence their teaching practices. So the journal clubs can influence your teaching practices. The second thing is one has to use the questions during the journal. Always keep on asking, is it original? It is something new. Is it true? Are the conclusions justified based on the basis of the information provided? And are they in alignment with the objectives which they start? Are they important? Will it influence the educational practice in your own institution, in country, or the rest of the world? And what influence it has? Should you change the way, whatever you are currently practicing? You should ask yourself, is it necessary for me to change based on that? Some journals also carry a box that asks what is known about the subject and what does this paper add? And that also helps when you are discussing during the journal club. Most of the articles you will see will fall into three categories. One is a description, that is what was done. For example, problem-based learning. How do we do the problem-based learning, or for any teaching method or for any assessment method? But these articles are lesser, and this is an older data, 2008, but I don't see there is much of a change in that. The second level article are the justification results. Did it work? And most of the articles nowadays we see belong to this category. Is PBL working? And if so, what are the evidences for that when you are making that statement? And the third one is the clarification. Again, the articles are very less. Why and how did it work? And how and why PBL work? And for that, we have to think from the different angle also, which we learn when we are doing this educational research journal club, and I will come to that. So for many times, you will see in this educational journal research, the purpose is given. As I said earlier, there may be description of what is done, sometimes explanation why and how the phenomena occur, sometimes for the understanding of something, exploration, sometimes solving the problems based on evidence, sometimes there is a prediction based on the observation, or there is an influencing the others, showing that, okay, I have applied it, like the article on the educational issues journal club. And the informing others why this particular policy came into existence, and evaluation and improvement in practice. And when we do the science research, we miss this evaluation and improvement of practice most of the time. The participants of your journal club will definitely understand the similarities between the traditional and the educational research, that they will understand there is an attempt to change, there is a problem identification, research question, then planning, selecting the sample, deciding variable. All these things we are quite aware of that, and drawing the conclusion and the striving for the objectivity. But they will also learn about this evaluation, which I said many a times in education as a teacher, without knowing that I'm going to do this thing. We do a lot of educational intervention. We do number of educational programs. We develop modules and we insert in our curriculum. But we don't follow it up. So this is something as a systematic process to acquire, analyze, and interpret the information to provide feedback about that program, activity, and policy. So it goes in the similar manner as our research, educational research. But there is an evaluation question, and it is a gathering the evidence regarding its outcome or the processes. How it will benefit to our institution if we have this educational research journal club and start looking at the evaluation of the article, because we will learn how it tells about the existing practice and program, how it is useful. It will consider the opinion of stakeholders, which will remind us who are the stakeholders for what I have done in my institution. It finds out the explanation to the issues related to the program, and that may be the issues I may be facing in my program. And it helps to take decision as to whether it is worth continuing the program or the policy, or some modification is needed. So it stimulates and it inspires the readers when they read about this. So your readers will come to know there are certain fundamental basic research or some educational theory, or which many of us, we are not going to work in that direction. But we are definitely going to do the applied research. Suppose someone says that team-based learning, PBL, or for that matter, feedback, we are going to apply it and see whether it is proves and whether there is a generalization, or we are going to do the evaluative research, as I said, to improve our own program in our local context. But during this entire process, what we learn is the critical appraisal. That means we are going to carefully, systematically examine that research evidence which is presented in the article, and to judge whether it is trustworthy, whether it has value, and it is relevant in a particular way. So during journal club, if it is an educational research journal club, you can follow this. You should read the research question and how it has been addressed. Dissect it out in a Picot style, and all of you know Picot: population, intervention, comparator, outcome, and the time. Discuss the study design and how randomization was done. Discuss the study population, inclusion, exclusion criteria. Discuss results, examine whether the statistics has been used correctly and effectively. And here also, that's why the leader has to be expert, or leader should take the help of the statistician. And check the discussion section for clarity on that author's perspective statements, on their supportive statements about their research. What future directions are suggested based on that finding. And you also discuss, as I said earlier, can this research get replicated? What is the take-home message for that paper? And again, what was known about this topic previously and what the study is. So keep always your antenna up when the journal club is going on. I will suggest that one should also refer to the reporting guidelines when you are discussing this article. The first guideline, that is International Committee of Medical Journal Editors, they always keep on changing their guideline. And the recent one is January 2024 update. But they have different sections. And the important one, though it is for the manuscript preparation and submission, we know what is missing in the article which we are reading. And that will help us to learn the critical appraisal in a very systematic manner. There are other guidelines also, guidelines for reporting trials, guidelines for reporting the observational studies, the PRISMA guideline for the systematic review meta-analysis, Oration guideline for the reporting qualitative research. Keep track of which guideline you are using. Not all are useful for the educational research because they are mainly for the science research. But the STRO, PRISMA, Oration, you can easily use for your research. And here comes the qualitative research, which I told you that we don't use this particular approach. But we have to remember that education is a socio-behavioral science. The quantitative research, what we do is always deals with the number. We are trying to be very, very objective. But it has a philosophy that the truth and the reality already exist. And through our research, we are discovering it. But in case of education, we have to learn about the social setting, where the students are and where the teachers are. And the people in the social setting, how they are interacting with their surrounding and interacting with each other. And they have lived the experience. So what are their perception for that lived experience? Because the human behavior influences your outcomes. You can't have that double blind and randomized control trial as we are going for our clinical trials. The another thing is the perspective that two people may be in the same situation, but they are looking at them from a different perspective. And one may say it is 6, the another may say it is 9, but both are right from the way they are looking at that particular situation and what they have experienced. And this is very, very important to remember. It is like an elephant and those 6 blind story, that everyone is looking at the reality, what they are seeing as a reality. But as a researcher, you construct ultimately that reality using whatever the individuals are interacting with their social worlds. And this is very important. And this will tell you not just the social settings and the people in the social, but how people make sense of those different phenomena. Why they are thinking that this particular take example of PPL is beneficial for me. Why they are thinking so, or why they are thinking mentorship or mentee program which is going on in the college is not useful. So they can look at it. Their experiences can be seen, and what are the different factors that have influenced the situation from the participants' perspective. So the educational research, there will be definitely interaction amongst the participants. Your students who are there in the class are going to the hostel, they are going to interact with each other, they are going to talk to each other on phone, and they will be also having interacting with surroundings. They may not attend your lecture, but they are going to learn it on the social media. So their perception, their interpretation, their expectation about the outcomes are also varied. And therefore, RCT's rarity usually in the educational research. So you can have quantitative research, you can have qualitative research, but as I said, quantitative research will tell you what? More objective, more outcome oriented, but the qualitative research will give you why and how patient. And we don't follow these to that extent. And that's why the articles which are there in the last stage, where there is a when people are finding out why and how a particular thing is working, are very, very less. So it is a process oriented. And in search of that research question, we have to remember that we have to focus on that answer, getting the answer, not whether we are going to do the quantitative research or the qualitative research. And that's why these mixed method research designs have evolved. And only hearing this words and only hearing attending some sessions on the qualitative research, we are not going to get the clarity unless we read those articles, unless we discuss with each other. And therefore, educational research appears to be doable. It has same principles as traditional science research. It doesn't require costly equipment. Not many co-investigators are required within our budget. You don't have to spend time with your patients or lab work. Minimum risk, but it improves the educational practices, and that is gratifying as teachers. In India also, we have seen earlier that since 1942 to 2020, there is a rise. But we have to ask now, this is a time to ask, what about the quality of the research? And the critical appraisal skills we learn in the journal club will help us to do this. Now, if you look at the evidence from the literature, the benefit of journal club, the first evidence comes in 1988. And that is the impact of medical journal club, not our education journal club, on reading habit, knowledge, critical appraisal skill. And see, that what was done was a randomized control trial. So actually, now we should go back and do the critical appraisal of that. But it was according to whatever our knowledge also evolved through all these years. So that time, these people have done it. And their conclusion was the reading habits definitely improve, knowledge slightly improving, but critical appraisal skills are not improved in 1988. Then later on, I found an literature review. They looked at the effectiveness of journal club, translating the knowledge into practice. And when they looked at the various articles published between 2008 to 2018, they found these four themes emerge, which are interlinked with each other. That journal clubs encourages discussion among healthcare professionals. It enhances critical appraisal skill. It develops the knowledge about evidence-based practice, and that impacts the participants' clinical practice. But again, these journal clubs are science journals. If we apply that, I think we can apply that to the educational practice as well. But further exploration of that, I found one 2011, one article was, abstract was published in Really Good Stuff. Next, they called their journal club as Next Gen Journal Club because they had a new curriculum. And to understand the new concepts in teaching and learning, they started this educational journal club activity. So they found that team-based learning was very important and interesting. And while learning, going through these articles, they developed in the college a TBL interest group. And that group recommended curriculum committee of that institution to introduce this in their curriculum. So that faculty development, the curriculum committee then conducted a faculty development program of 20 hours followed by introduction in the curriculum. So that is something as a benefit to that. There is another short report which was by the Stanford University, the School of Medicine and School of Education. They conducted the journal club meeting of faculty and students from medical as well as from the School of Education. And they reported that that helped in building community of educators. They established a bond between the two institutions, and that gave rise to research projects in collaboration. And that supported to the peers who wish to pursue the joint careers as educators as well as physicians. So there are some benefits reported. And then this is an article where the quasi and experimental design was used. They published the 8 years experience with medical education journal club. And in this, according to this, they found that this medical education journal club is worthwhile doing it. But it was a self-reported increase in the critical appraisal of literature. And certain, the participants felt that some of their behaviors related to the use of evidence in the practice that has been improved because of that. What I feel, if we look at the educational research journal club, looking at all these things and looking at the journal clubs in the science, they will foster the research culture in the institution. They will provide the opportunity to promote the interest in the research, learn about the knowledge gap, formulate the future research question. They will learn about formulating the research question as well. And they will guide the research, at least develop that literature awareness. And sometimes after the journal club, if the discussion goes well, if you really could do the critical appraisal well, you can write letters to the editor after that discussion on that original article. Or you can always, as I said earlier, display it on the institutional website. So what is happening over this? That slowly from that reader's position, you are going into the position of evolving and going into that educational researcher. So you must have heard about the educational scholarship and scholarship of teaching learning. We do effective teaching when we use the teaching methods that support the students' learning. But when we start using the the teaching methods, which are really grounded in that research, which is you are learning through this journal club learning, which are published in the articles, you are consuming those things. And your teaching slowly changes to the scholarly teaching. And maybe as you start evolving as a researcher, you start like feeling that, why shouldn't I do that? And why shouldn't I work on this direction? And then you yourself can earn the scholarship of teaching and learning. You can create and disseminate it. So from just using the method, you go to the consumption and to the production stage. But like any research, there are reported hurdles in the education research. And these are all the hurdles which I have mentioned. I'm not going into that, but they are during planning stage, during research and after the research. They have emerged from the educational research, which are reported for the educational research and not for the science. The lack of training in the research methodology and lack of time are the most important ones, but they can be handled. What I felt very important, what people have mentioned about the educational research, the hurdles like lack of local experts with educational research background. So getting started itself becomes difficult. Lack of office of research or the coordinator. Difficulty in finding the faculty mentor. Unaware of information regarding what research offers locally. Leadership support is lacking and lack of recognition or appreciation. And all these reported hurdles are amenable to human connectivity. The connectivity between the two individuals. And why the human connectivity I feel is important in educational research and any other research, because of the benefits it offers. It has three major benefits. One is emotional, that feeling a sense of belonging to a person or a group. Second is a cognitive one, that you are learning something new from your peers. And the third one is the practical or functional, that you are receiving the help or assistance when you are facing a problem. And mind you, all these three categories are not mutually exclusive. Any human being will require all the three categories, the human connectivity belonging to all three components of the human connectivity. And therefore, this journal club activity, when you are coming together, when you are socializing, you are discussing, and as someone said, I mentioned earlier, that bond is occurring. There is a social networking, and you slowly evolve in a community of the community of practice. And you can share, you can discuss, you can have some like-minded people are together. Your set of values, your beliefs, your knowledge, experiences, they are focusing on some common practice, and that is an improvement of education. You will find mentors in the group when you are coming together, and there are always a peer support. And this is very, very important to have this research journal club. And this article is again in 2010 about the research journal club. There is the pedagogy of the research while you are preparing the students for the educational leadership. So what I would like to appeal at the end to all of you, try to initiate the educational research journal club activity in your own institution. I'm sure you may be saying, what's in it for me? I will say professional and personal growth. And that gratifying feeling that you have contributed to the generation of critical mass of HP who are also the researchers, what Chetna had said earlier. And if you do that, I think then it will be a real tribute to late Dr. Rita Sood that we are following her footsteps. Thank you. Dr. Sanjay, should I stop sharing? Hello?
Yes, ma'am. You can stop sharing. So just a moment. Just just a moment, ma'am. There is a yes.
Sanjay, you're not audible. Dr. Sanjay,
Yes.
you're not audible.
Yes, ma'am. Just a moment.
Okay. Very well presented, Dr. Nima. Excellent coverage of the topic. I hope and I'm sure many people will be inspired to start journal clubs in medical education after listening to you.